Hey, I'm Dr. Jules, and today I'm gonna help you improve your breathing after having a baby. Now, when baby is starting to grow, our ribcage starts to expand outwards, and that's normal. But in our postpartum period, it's really important to restore our breathing and improve our diaphragm function. Now, our diaphragm sits underneath our ribcage, and it goes down into our abdominal cavity as we breathe in and comes up as we breathe out. It optimizes the amount of oxygen that we can get, and it improves our ability to tolerate endurance type exercise. Start on your back. Place one hand on your belly and one hand on your chest. Just close your eyes and try to breathe normally without really thinking about it. Does your bottom hand or your top hand move more? If your top hand is moving more, you're breathing a lot more through your chest. Let's focus in on trying to get that bottom hand to move. As you take a breath in, think about focusing and pushing air towards your bottom hand, expanding through your belly. As you breathe out, let that hand just fall naturally towards the floor. Breath in and out. Next, I want you to place your hands on the sides of your rib cage. As you breathe in and out, notice what's happening at your hands. This is just a normal breathing pattern here. Check in with yourself and see if there's any movement. If you're having trouble feeling if there's movement, take a big inhale. As you inhale, your ribs should be expanding out towards your hands. As you take a big inhale, notice how each side is moving. If one side seems to be moving more, go on to that side and then try to get the side that's not moving well to expand better. So when you're on your side, have your head supported, put your hand on your rib cage and breathe. Big inhale and try to fill your side body. Exhale, everything nice and relaxed. Big inhale and exhale. Now I'm putting a little bit of pressure down on my ribs just to help to give my body some feedback on where I want the air to go. Once you get that down, then check it again lying on your back. And see if you notice any improvements. So now that you know how to breathe into your belly and into your sides, it's also important to learn how to breathe into your back. During your pregnancy, your back starts to become a little bit more stiff. And that's on purpose because now baby is growing forward and it's moving your center of gravity forward. So your back needs to be able to stabilize for that. So it might feel tight and stiff right now, and that's okay. But it's something for us to work on. Now, in order to get more expansion and to decrease any stiffness you have in your back, there's a few positions I want you to try. Get into a comfortable sitting position. Place your hands on your back and breathe. Your hands should be right below your rib cage, and you should be trying to take a breath in and expand this area. If you're noticing one side feels a little tighter, lean to the left or to the right and breathe into that side. Another one of my favorite positions is a child's pose. It's so relaxing and it really helps us to expand through our back. Sit onto your knees and reach forward. Think about breathing and expanding through the back, placing one hand there if you need to. Big inhale, let your back fill with air. Exhale and relax. Child's pose feels kind of difficult for you. Another great way to work through back body expansion is to sit with your knees bent up and hugging around your knees. I want you to think about expanding through that lower back area, placing your hand there if you need it for some feedback. Big breath in and out. Big breath in and out. You can fold forward, rounding through your spine too. just to elongate some of the paraspinal muscles, which are the muscles that attach at the top of the base of our skull and run all the way down to our pelvis. For more breathing tips or other tips about postpartum recovery, come follow our link below or check out our website. Thank you so much for joining.